Hey guys, so I wanted to bring Evan Brand for our second interview. I met Evan Brand at the JASA retreat this year. Blew my mind with his presentation. His ability to explain things that are very complicated and simplify it and get everybody to relate to was amazing. So I wanted to bring Evan Brand on here to talk about functional medicine and getting to the root cause of your problems. So I want him to talk about how you can start asking yourself why. And that's how I grew up. Why does this happen to me? Why do I have acne? Why am I bloated? Why do I have thyroid issues? And start thinking of how you're going to get to the root cause of your health problems instead of thinking, I'm just going to take a pill and mask the symptom, and introduce you to functional medicine, compare it to conventional medicine. So, Evan, you can take it away and rant all you want, say whatever you want. I just want people to know that you're out there. And at the end, I'll have Evan share his information and how you can get hooked up with him and work with him.
Totally. Well, thanks, Lucy. I'm glad you enjoyed the talk. When I got done with that talk, I thought, man, was that too deep? Because some people like had their jaws dropped, and I was like, oh, maybe I went too deep today. But I'm glad you enjoyed it. That means other people hopefully did.
Yeah, I think their jaws were dropped because they could relate to it. I mean, a lot
Yeah,
of heads were shaking, and that's when you know people are really getting it. You'll say something, and then their head are shaking, like, yes, that is me.
yeah, sure thing. Well, where we could start with the whole conventional compared to functional approach would be digestive issues, for example.
hmm
Many people have any type of digestive issue in the category of bloating, indigestion, heartburn. They may get diagnosed with GERD,
hmm
and that's typically when you get referred from a conventional doc over to a gastroenterologist. They may put a scope down your throat and do an endoscopy. There are risks associated with that because the people who clean the medical equipment don't do a good job a lot of the time. And you go to get a routine procedure like an endoscopy, and that could have antibiotic resistant bacteria on it, and you get that put down into your gut, and then you leave the hospital with MRSA or some other potentially lethal antibiotic resistant bacteria, all because you had some heartburn. And this is just what conventional medicine does. They like to do tests, but they like to do tests that are very pathogenic based, meaning they're really not going to find anything unless you're very diseased and you're dying.
hmm
Otherwise, the test you do from them, including blood panels, they're going to say, Lucy, you're fine. Go home. It's all in your head. You're okay. Just go take some Miralax, which is what a client I actually spoke with this morning. She said that her doctor told her for any type of digestive issues, take either Miralax or Pepto-Bismol.
Mm.
And we know that both of those formulas are loaded with artificial sweeteners, artificial colors, all sorts of other chemicals, and it's not getting to the root cause. So where functional medicine comes in, let's take heartburn, for example. We would look at someone's gut by using stool testing, comprehensive stool testing. I had a girl who flew to India. She lives in Dallas. She flew to India. She came back, and we tested her gut, and she had a blastocystis hominis infection. She had all sorts of crazy symptoms, vertical ridges on the nails. That's one thing you could do. You take a look at your nails, see if there's any issues there. And she showed up with an infection, and we were able to get rid of it. Now, this is after she went to some prestigious hospital, and I think she actually drove to Houston. Maybe it was in Dallas. Either way, some prestigious hospital, top-rated doctors. They have 20 letters after their name, and she sends me over the labs, and it comes back with nothing. They say, you're fine, go home. But here she is having diarrhea 7, 8, 9 times a day. That's not normal. You're going to waste away pretty quick if you keep that up. So I said, okay, we had just run a stool test on her before, the week before she went to India, and it was clear. But we ran it the week after. I said, I hate for you to have to pay another $400 for this test, but we have to because you're symptomatic. So we found the infection, and then we're able to get rid of it by using different botanicals and herbs. Now, with the issue of heartburn, for example, many people that I find, they have an infection called H. pylori.
hmm
It's a bacterial infection. Some people don't have any symptoms at all, but it's been found to be the root cause of more than 90% of stomach ulcers. So people are wondering why they get ulcers. Conventional medicine, they'll come in and they'll put you on a PPI, a proton pump inhibitor, which tells the parietal cells in your gut that normally make stomach acid, it tells them to go home. You don't show up to work today. You don't need to make any stomach acid. Now, as you already know, Lucy, but many people may not know, You have to have adequate levels of hydrochloric acid and enzymes in your stomach to break down your food. So let's say somebody's already tuned into the nutritional message that you talk about with some good grass-fed beef, pastured animals, organic veggies. You're spending all this hard-earned money on your food, but if you have an H. pylori infection, or if you're chronically stressed, or if you're scrolling on Facebook while you should be eating your meal and chewing your food, your body doesn't know whether it should be focusing on the murder story that your friend shared on Facebook, or should it be focusing on digesting your food and secreting acids and enzymes. So a lot of this is done to ourselves. We sabotage ourselves. And then we go to the doctor and we say we have heartburn. And then now Nexium and Prilosec, I believe those are both over the counter now, but they used to be protected where you could only get them through a prescription. So now these weapons of mass destruction that I consider, these PPIs, you can go and just go to Target right down the street and go buy a box of them and start popping them like candy.
Wow. So if you have heartburn, okay, I'll just take a pill and hopefully that gets rid of it.
Right. And it may take away the symptom, right? It may reduce the heartburn.
Right.
But what people fail to realize is heartburn is just a symptom of dysfunction. And if you're just lowering stomach acid to reduce the burning sensation, yeah, you're lowering the acid, but now what you're doing is you're opening yourself up to leaky gut. Well, you ask, how is that going to happen? If you're taking low stomach acid due to chronic stress and you're lowering it even more with a medication, what you're going to do is you're going to allow your food to rancidify and putrefy and rot in your stomach, and then you're going to be feeding all sorts of yeast. So 9 out of 10 people, when I run an organic acids panel, which is a urine test, people show up with candida problems, even if they have a clean diet, because they were stressed for so long that they've tore apart their gut lining. So if people listening, if you take your fingers, you interlace them like you're praying, and then you pull apart your fingers and you look through these little gaps, that's leaky gut, which the fancy term is intestinal permeability. So you have low stomach acid, this grass-fed beef's just sitting in your tummy, rotting away, and those molecules that normally should be too big go right into the bloodstream. So then you start to get other manifestations like acne or rosacea or eczema. So what do you do then? You go over to the dermatologist and you say, look at my skin. And they say, oh, okay, Lucy, here's some steroid cream, some hydrocortisone cream. Go ahead and put the steroid cream on, and if it doesn't come back, excellent. My wife at one time was covered head to toe in hives. We ended up finding out after going through 5 dermatologists who ran a patch test on her that it was all the parabens and chemicals in her skincare products. However, there's still a gut component always to skin issues, without a doubt. She went through the steroid creams, the eczema would get better, the hives would get better, it would come back, and she just went through this cycle. Now, the goal of functional medicine is to try to be as investigative but holistic with WH, like holistic. That's the way I say it, because if you're a cardiologist, you're only looking at heart issues. If you're a gastroenterologist, you're only looking at gut issues. If you're an ophthalmologist, you're only looking at eye issues. However, if you're looking at the functional approach, you're combining all of these together. So I'm not an expert at cardiology by any means, but I do know, for example, that under this chronic stress picture that we're talking about, we're taking the instance of heartburn, we're taking someone's acid, we're lowering their acid even more. Now, the taurine and all the other amino acids that you're supposed to get from your meats that help to fuel your heart, now you don't get those. So then, after 20, 30 years of being on a PPI, now there's links to Alzheimer's, there's links to heart disease, because you're starving from the inside out. You're not digesting any of your food. So now you're brain fogged. Now you're bloating. You have gas after your meals. You're burping. You have excess belly fat. You're exhausted in general. Your sleep is probably restless. You could have a lot of sugar cravings because just like you want to eat, the yeast wants to eat. So if you have that going on in the gut, it wants to keep itself going and keep the cycle going until you test it, you find it, and then you kick it out. So my philosophy now is if you don't test, you've guessed, because I bought hundreds of supplements back in 08, 09 when I was struggling, and I got a diagnosis of IBS, irritable bowel syndrome, which is the generic term for I don't know. I have no idea what's going on. And the doctor tried to write me 3 prescriptions. She wrote me an acid blocker. She wrote me an antispasmodic because that was supposed to fix the diarrhea. So let's just use a drug to slow down the transit time of your bowels. And then there was one other drug that I can never remember. And I asked the doctor, I said, well, let me ask you this. And I said, if I take hydrochloric acid, if I take enzyme supplements with my meals, my stomach feels better and my IBS symptoms go away. Why are you giving me an acid reducing medication? She goes, no. Adding more acid is not going to fix you. It's going to make you worse. Don't take that. You're going to hurt yourself. Okay. And then I said, no thanks to the prescription. Keep your piece of paper. And I left. And I was shaking my head and I thought, I've always had concerns about the conventional healthcare model being able to treat chronic symptoms like this. Why did I subject myself to that? And I felt stupid. I literally left feeling stupid. Now, I'm not against mainstream medicine. If I break my arm, if I get in a car wreck, if I'm bleeding out and I need somebody to reattach my arm, please take me to the emergency room and get me help. But if I'm struggling with depression, which was my main symptom that got me into this health space in the first place, if you're dealing with anxiety, if you're dealing with bloating, IBS, diarrhea, constipation, those are not diseases. Even chronic fatigue, which is a relatively new disease, like you didn't hear about chronic fatigue 10 years ago. Now it's everybody has chronic fatigue or fibromyalgia, right? Well, these diseases are named diseases because then the FDA can legally prescribe drugs for them. If it's just a symptom, you can't. So if you're chronic fatigue and that's just a symptom, you legally cannot create or manufacture drugs. However, as soon as you classify it as a disease, chronic fatigue syndrome, fibromyalgia, attention deficit disorder, then the FDA says, okay, now you can make drugs. So then you see Ritalin, and then you see Vyvanse, and then you see all these immunomodulating drugs like Humira, for example, for rheumatoid arthritis. And a lot of these diseases are just managed, right? But what if we take a look at somebody with chronic fatigue syndrome, and this is what I do very often, I'll take a look at their adrenal hormones with a saliva test, and most likely their hormone levels are going to be low due to chronic stress. The body's trying to save itself. If you're running from a bear 24/7, even though that bear is just a notification, ding, of your smartphone, your nervous system doesn't know the difference between a real threat and a perceived threat. So it's going to continue pumping out cortisol until you start eating all your muscle tissue away. And then the brain says, look, we can't do this anymore. We're going to stop producing hormones. Now, with chronic illness like we're talking about, rheumatoid arthritis and joint issues, multiple sclerosis, all of that, yeah, there is an autoimmune component. So that's a whole other podcast. But with these root cause approach, if we look in and we see that someone has an infection like Cryptosporidium, a parasite that I have myself, which we know tears apart the lining of the small intestine and the stomach, that's going to be creating that leaky gut situation and making it even worse. So then people are having all these undiagnosed food allergies. But the problem is, if you're in such an inflamed state, if you get somebody to run a food sensitivity test on you, everything could show up.
Yeah, that happened to me. I was sensitive to mushrooms, avocados, everything that I was eating, I showed up as sensitive. And I asked the lady, I was like, obviously something's going on with my system. I shouldn't be sensitive to everything. I'm just having an inflammation response to everything.
Yep.
So it
That's
needs
what
to be
happened.
more than just cutting those foods out, because then I'll just become sensitive to the other food groups that I'll add in.
Exactly. I have people that beg me to run food sensitivity testing on them, and I won't do it. I literally won't do it because it is not going to answer all of your problems. The issue is not what foods are you sensitive to. The issue is why are you sensitive to foods? And a lot of that has to do with an immune system that's compromised, because in this fight or flight chronic stress mode that we're talking about, you lose the balance between cortisol and cortisone. So for example, let's say you hurt yourself playing tennis. What do? You go to the doctor, they give you a cortisone shot, right? To try to balance that cortisone balance out. If people are more balanced towards, or they're more slanted towards cortisol, fight or flight, stress, and they don't have that cortisone balance, cortisone is your natural anti-inflammatory that your body makes on its own. You don't need cortisone shots. But if you're in fight or flight and your nervous system's wrecked, you need that cortisone shot to try to shunt you back towards that natural anti-inflammatory mode that your body can do itself. So that's just kind of another failure where the underlying issues are not really discussed. They're just, here's the quick fix. But then what happens when you go play tennis again, your nervous system's still wrecked, you're going to hurt yourself again. And then you got to come get another cortisone shot. And then you get cortisone resistance where the shots don't work anymore. So then you get tendonitis or tennis elbow. And then they're saying you need surgery on your wrist because of repeated muscle injury. So it's just a very scary place because there's a cascade of interventions that happens. Now, I know we've kind of bounced all over the place, so you reel me back in.
No, this is perfect.
Okay.
Do you think people get attached to their health problems or disease? They like to see themselves more as a victim and they don't want to put themselves in the other side where it's like, I could be causing all of this. I feel
100%.
like that might be, I think people have a hard time going from one extreme to the other of, poor me, this happened to me, it's not my fault. And then the other side, it's, I'm causing this, I need to change my lifestyle, I'm in control. So they have a hard time transitioning from one side to the other.
Yep,
Do you see that with
1,000%. 1,000%. People don't want to own anything. Generally speaking, and this is not against anybody listening, generally speaking, you look at humankind. We are not responsible people, and we don't want to be responsible. You see people throwing out trash. I was on Hurstbourne Lane, which is a pretty busy road in Kentucky, in Louisville here, and a guy just throws out an entire bag of trash, like an entire fast food bag of trash, and a cup with soda in it. And there's 100 other cars around. So I was going the other way, and I honked at the guy. And I'm like, are you kidding me? So people don't want to be responsible for their own crap, literally. Flush it down the toilet, it's somebody else's issue. And this is to a fault because then when something does go wrong with someone, they want the doctor in the white coat to save them.
Yeah.
And doctors for a long time, even in my grandparents' era, they're perceived as gods. And they don't want to question anything. I questioned the cardiologist when my grandma was in the hospital. She had congestive heart failure where she was having a lot of fluid buildup. It was scary. And the what is it? I can't think of what they're called. The dietitian, I suppose is who it was, brings in her meal. And for lunch, she got Smucker's peanut butter and jelly. And the first ingredient in a cardiology unit, mind you, was high fructose corn syrup. And the cardiologist was in there, and I said, do you support this type of nutrition, high fructose corn syrup, modified fats, hydrogenated oils? Are you supporting this type of diet for someone with congestive heart failure? He had nothing to say, literally no response. And he leaves, and my grandma's like, you need to be nice to him. It's like, Grandma, no. I've talked with medical doctors. They get 2 hours of nutrition in school. I've had over 1,000 hours at this point. I've had 500 hours in functional medicine, another 225 hours in nutritional therapy. That's not to toot my horn, but that's just to say that I spent more time looking at this stuff. And you can't just come in with a pharmaceutical and hope that that's going to shortcut the nutrition. That's going to shortcut the work that you have to do. Now, people have the choice every day, Lucy, and I know you know this too. Every time they pick up that fork, they have the choice. Am I going to be helping myself or am I going to be hurting myself? A friend of mine, this guy, Dr. Rodney Ford, he's out of New Zealand. He's got the coolest accent ever. He's a pediatric gastroenterologist. He tells people, because I don't want to steal his quote, there are no neutral foods. It's either pro-health or anti-health. A cookie is not neutral.
Right.
A treat, a cheat meal, a treat, it's not neutral. It's either pro or against your health. And people have to own that. You can't wait until you have a disease and then you go to the doctor, please save me, give me a magic pill. Give me the magic pill. I don't have people demand pills for me, but they're better pills. They're anti-inflammatory omega-3s. They're probiotics. They're vitamin C. They're adaptogenic herbs for adrenal health. Those are the good pills that I'm happy to provide. But I still have to make sure that people are doing the foundational things, such as getting up with the sun. Cortisol and all these other hormones, they're regulated by light. If you're living in a home where your blinds are shut and you're the type of person who puts on your sunglasses before you even walk out the door, you likely have hormonal issues. If you can't handle bright light, meaning if you take off the sunglasses and you're having to squint that you can't even see anything, you probably have some adrenal problems. Because someone with healthy adrenals should be able to handle that bright light. Because our ancestors, they didn't have sunglasses. How did they deal with bright light? Now all of a sudden everybody needs sunglasses? Well, adrenal issues are tied into that. There's a test you can do. People can look it up. It's called the Pupillary Reflex test, where you can take a flashlight and you put it at a 40. It's a pin light. You don't want to do like an LED on your phone. Don't do that. It's a pin light, so it's like a little incandescent bulb, and you hold this light at a 45-degree angle in the dark at your eyes, and you look at your eyes in the mirror. Your pupils in a pitch black environment, when that light comes in, your pupils should be able to constrict, and they should be able to stay constricted for about 15 to 20 seconds. Now, when I was working out of a chiropractor's office and I was evaluating people face to face, I would do this test. Many people, their pupils would constrict, and then 2 to 3 seconds later, their pupil would snap back open because they don't have the mineral balance and they don't have the adrenal health to deal with that light exposure. So those are the people that just have to have sunglasses on, even when it's not a bright environment. They have adrenal issues going on.
Interesting. That's
Yeah.
why I'm working with you. This is me when someone opens the door. I'm like,
It's
light.
bright.
It's super sensitive.
Yeah.
The last thing I want you to talk about is where can people go? Because it's scary not to listen to the doctor.
It
It's
is.
scary to not do what he says. Like my best friend just had major abdominal surgery. She had a cyst as the size of a football in her left ovary. So she ended up losing her ovary, and then the doctor, before you leave this hospital, you will be on birth control. You will be on the pill for like the rest of your life. That is scary to go against what your doctor says when you know, because she's read some of the stuff I posted. She knows birth control. It probably won't be the best option. But where do you go from there? Because it's scary not to listen to your doctor because, you know, your health is in their hands. So finding people like you, obviously, but where else can people go and find this information?
That's a good question. I'm a huge fan of Dr. Mercola's work. If you type in Mercola and your problem, you're probably going to find some information that he's written about. I mean, this guy's been in practice for over 25 years. He is a little bit in a different field. I wouldn't say, I'm not even sure if he's practicing anymore. Anyhow, his blog, Mercola.com, is the best place that people can go. Primal Docs is another one. You can check out other practitioners. There is, I think it's called Paleo Physicians Network is another one where people can go and find more holistic, more functional people.
Perfect.
I'm not against naturopaths, but I would advise people to go to a functional medicine practitioner any day over a naturopath. I've gone to naturopaths. I've had many people go to naturopaths before they come to me and they leave disappointed. Reason being, they're typically not a diagnostic practitioner, meaning they're not going to be running labs. You're going to go in and they'll leave you with a homeopathic remedy that could probably help you and it's not going to hurt you, but it's not necessarily going to address the root cause. So if I just go back to that example one more time of gut issues, let's say someone's having diarrhea. There are herbs that I will use with people to stop the diarrhea while we're waiting to get their lab result, but I'm still waiting on the lab result, where a naturopath may come in and say, here's this homeopathic or here's this other remedy to stop the diarrhea. Here's some herbs. It's natural. I hope you feel better. But here's the problem. The symptoms gone or maybe relieved, but they still have the infection that's causing the body to try to flush that bowel out in the first place. Now, there's links between parasites and ALS. If you remember the ice bucket challenge that got real viral, Crypto Giardia, the parasites I had, parasites can be linked to things like ALS as a trigger. So when I saw that on my lab result, I was like, oh my God, I got to take care of this ASAP. And I retested and I was clear. Thank goodness. So you really, really, really have to be a good investigator. And if you're scared about taking your health into your own hands, don't be. You have to realize, and you got to look face to face with yourself in the mirror and realize, look, nobody's coming to save me.
Right.
If you dial 911 when you're having a heart attack, the ambulance is going to come and they're going to try to save you. But what about the gut symptoms that keep you up at night? What about the anxiety that could be debilitating? What about the depression that makes you debate suicide? You know, these are the symptoms where typically you're not going to get the real help unless you get your hands dirty and you start digging in the trenches yourself. Thank gosh for the internet. That's enabled a lot of people to get information. Not all of it's good information, but that's a starting place. Start reading around on forums. Start looking around, like I said, on Mercola's site. They could check out my site. I have over 200 podcasts now. I mean, we're talking probably 250 hours of free content. YouTube's another good place. The answers are out there, but you need to do things in the right order. I'm sure we could go on and on and on, but do things in the right order. Get your hormones healthy, get your hormones checked out, and get them healthy first, because cortisol is a catabolic hormone, meaning it'll eat your muscle tissue away, but it also eats away other tissues, including your gut lining. So if you're somebody who got sold on some detox cleanse or detox protocol or some gut cleanse protocol, but you haven't fixed your hormones yet, you need to do that, because if the cortisol is not in a good place, if your rhythm is dysfunctional, you're still going to be causing leaky gut. So then if you jump on some detox program, even if it is like a paleo-based detox cleanse, you're going to be releasing toxins into the bloodstream. So you have to make sure the hormones are good first before you dump more toxins out of the fat cells into the blood. So 2 is you got to get that gut healthy. Make sure everybody deserves the right to be free of infections. I use a test called GI Map. It's a 1 day, 1 sample. I used to use the one I talked with you about. It was a 3-day test. I'm finding more infections on this 1 day, 1 sample. So it's a lot more convenient. You're not collecting poop for multiple days. So it's a little bit easier, and it's not as gross to deal with. Get your gut checked out. Make sure you don't have any infections. 1 in 3 people I test has an infection. Step 3 is that's when you go to detox. Once your gut's healthy, once your hormones are healthy, then you can try to work on your milk thistle and your dandelion root and your detox teas and your metabolic boosting products to try to up your metabolic rate and flush toxins out of your fat cells. If you just keep doing diet and fitness over and over, but your fat cells are loaded with toxins, you're not going to lose weight. This is why the diet and fitness gurus fail. It's because they're not looking at this detox component. If you have these hormone disruptors, if you have these thyroid affecting drugs, if you're drinking tap water that has remnants of pharmaceuticals in it, all these things are stored in those fat cells. So until you can remove those toxins out, it's possible that you'll spin your wheels. So eventually I can graduate people to like an infrared sauna or some type of detox therapy, but it's very, very at the end of the rope. It's at the end of the program, because you can make people real sick if you do it too soon. So before I let you go, last thing, don't detox first. A lot of people, they might go conventional American diet straight to like a juice fast or a juice cleanse or some detox. Please don't do that. Get the foundations in order first. Don't skip meals. Eat pasture-raised animals. Eat organic veggies. Don't be afraid of fat. Eat plenty of good organic, yellow, delicious butter with vitamin K in it. It's going to be helpful for you. Drink plenty of good spring water or good filtered water. I use a Berkey system at the house. Make sure you get up with the sun. Try to go to bed within the few hours of the sun, and change the way that you respond to stressors. You can look into emotional freedom techniques, so you can tap yourself. You can tap these acupressure points on your body and calm your nervous system down. If somebody cuts you off on the highway and you start tailgating them and you're flicking them off and you're raging, you're overreacting. Your nervous system's not in check. If someone sends you a text message and you're immediately sick to your stomach thinking of how you're going to respond to them, your nervous system's not in check. If someone says something to you, or you have a kid or somebody around you that just does something silly, or you're standing in line at Whole Foods and the cashier lady is too slow and you're losing your mind, your nervous system's not in check. You got to get that stuff straightened out before you can really do the deep work.
This is perfect. I mean, I've always, anytime I meet someone and I hear something, because that's how I grew up. My mom, if you smell bad, you don't need deodorant. You just are eating too much sugar. If you ever get acne, Lucy, you're eating too much dairy, too much gluten. At age 12, she cut out gluten out of my diet, and I told her she was ruining my life because I couldn't eat what my friends were eating. And she explained, Lucy, your intestines have little holes in them. So it's funny how I grew up so differently, and now I have this video. Now I just meet people. Just listen to this.
I know. Well, your mom's the savior, because
She is.
who knows what could have happened if you would have gone through the years and years of eating all the crap that I ate, being a bodybuilder trying to gain weight, thinking I need all of these complex carbs, and I was just shoving so much pasta down my throat and chicken breast and broccoli. I really hope, and I know you've probably seen these videos, I really hope that the bodybuilding community gets in touch with like the functional fitness community in terms of nutrition advice, because there's guys on YouTube, I won't mention their names, that are getting millions of views, and they're showing what I eat in a day, like a little video. And there's guys that are promoting like Reese Puffs, and you put it in a blender with protein powder with sucralose, artificial sweeteners, and that's your breakfast. And then you're just living on conventional chicken breast and conventionally pesticide sprayed strawberries and all that. It's crazy. And millions of people are eating this up and they're going on these low-fat diet plans.
Yeah, I mean, I see it the same with exercise. This is my workout. They're working out twice a day. They're in pain, and it's like no pain, no gain. It just kills me because a regular person doesn't need that. But they
Yeah,
see these people online, and they're like, "Oh, they can do it. I can do it too. This is the way." Because they look very healthy. They look fine.
yeah,
But no one talks about their struggles. I mean, some do, but no one talks about what they deal with, when the
totally.
screen, yeah, when the screen's off.
Totally. You
But this is
get you get
perfect.
you get abs in the kitchen. Remember that. Mostly. Mostly.
Mostly.
Over half of your abs can come from the kitchen. The other stuff you
I
do. You got
agree.
to do your squats. You don't need sit-ups. Do your squats. Do your core exercises. Get your core strong, and you're gonna be just fine.
Yep. But anyone listening to this who, if you're in Lexington, Evan is actually coming to Lexington November 12th, and he will be talking about stress and how to get to the root cause of your stress and a different way of stress management than most people have heard before. So I'm really excited for that.
Me too.
But this was awesome. So let me stop the recording. So thank you for listening, and I will attach everything that you've said, like all the articles and blogs. So give me 1 second.